If you need insulin therapy to treat your type 1 or type 2 diabetes, your doctor may prescribe a medication called Novolog. Here's what you need to know before taking it. When you eat, your blood sugar levels usually increase. Usually, the hormone insulin helps bring blood sugar into the cells so they can be used for energy. In someone with diabetes, they either cannot make their own insulin or the insulin doesn't work as it should, and this makes blood sugar levels get too high. That's when injectable insulin can help. Novolog is a fast-acting insulin. This is different from long-acting insulin, which gives you a steady release of insulin throughout the day. Your doctor may prescribe both types of insulin, so it's important to know when to take which. Novolog can help control your blood sugar levels around mealtimes, so you're less likely to see a big spike in your blood sugar after eating. You need to make sure that you eat within 5 or 10 minutes after injecting Novolog, or you could be at risk for hypoglycemia, also known as low blood sugar. Symptoms of low blood sugar can include feeling shaky, nervous, confused, weak, hungry, and tired. You may also experience a fast heartbeat, sweating, or chills. You should contact your prescriber if low blood sugar is severe, which can lead to unconsciousness or seizures, and it can even be life-threatening. Your prescriber is the person who wrote you the prescription. This may be your doctor, nurse practitioner, physician's assistant, or a specialist, like an endocrinologist. They'll work with you and your pharmacist to form your care team. Your prescriber knows your health history, so they know how the medication will help meet your treatment goals and how it might affect other parts of your health. You inject Novolog under the skin in your belly, buttocks, thigh, or upper arm. The injection comes in 3 different forms, and your prescriber will train you on the specifics of using your vial, pen, or pen-fill cartridge. Don't be afraid to talk to your pharmacist or provider about affordability. These days, there are many low-cost ways to get your medications.